The human papillomavirus, or HPV, is a very common viral infection which unfortunately almost always shows no signs or symptoms. It quietly lives in human cells where it multiplies and causes growths that can lead to cancer later in life, such as throat cancer and cervical cancer. HPV affects both men and women. It also affects people of all ages, including children. It is one of the most common viral infections. 4 out of 5 people, 80%, will acquire it at some point in their lifetime. In the United States, there are around 14 million new infections occurring every year. About 19,000 teens and young adults contract the virus each day. They don't even realize they're infected because they don't feel sick. They do not show any signs or symptoms of the virus, and they may pass it to others without even knowing it. Most HPV infections clear by themselves. However, sometimes the infection can stay in your body and cause various types of cancer, such as cancer of the cervix, vaginal, anal, as well as some oropharyngeal cancers. Cervical cancer is the 4th most common cancer in women globally. Worldwide, more than 500,000 new cervical cancer cases are diagnosed every year, with up to 100% of the cases attributed to HPV. And unfortunately, more than 50% of these will likely die of this disease. While HPV may be the leading cause of many women cancers, men have also their share of this viral infection, as about 4 out of 10 cases of cancer caused by HPV occur among men, in addition to a high incidence of genital warts. There's no treatment for HPV, and the best way to prevent HPV-related cancers is to get vaccinated. The HPV vaccine is effective in preventing cancer and pre-cancer infections. The CDC recommends that both males and females receive the HPV vaccination between the ages of 9 and 45. Early vaccination is best to help protect children. The optimal age of vaccination, according to the CDC, is between 11 to 12 years. The HPV vaccine is extremely effective in providing safe and long-lasting protection against cancers that are caused by the HPV virus for boys and girls all over the world. Females should have regular cervical screening tests to check for precancerous changes in the cervix. Current CDC guidelines recommend that females aged 21 to 29 have a Pap test every 3 years. Those aged 30 to 65 can have a Pap test every 3 to 5 years, depending on their doctor's guidelines. For the first time ever, we have the power to eliminate some types of malignant cancers. The WHO announced a global strategy for the elimination of cervical cancer by 2030. We are fortunate to live in a time whereby through cervical screening and vaccination, some malignant cancers can be prevented and even eliminated. Get vaccinated, get screened, and get tested. Together, let's lead the way towards a world free of HPV-related cancers and diseases. LAU Medical Centers, Rizk Hospital, St. John Hospital. Healing with compassion.